We have recently learned that psoriasis is a whole body disease. It's not just a skin disease. It's not just an arthritic disease, but it's a whole body disease. And what that means is that the inflammation from psoriasis affects your heart, it increases your risk of a stroke, and it increases your risk of a heart attack. It also increases your risk of simple heart disease. So we really want to approach the whole body when we look at a psoriasis patient. People with psoriasis have something called metabolic syndrome frequently. They tend to be a little bit overweight, and that contributes to concerns about their heart health. So people with psoriasis need to think about being a little bit more aggressive about their heart health. They need to think about a low cholesterol diet. They need to think about exercise and trying to keep their weight under control, as well as keeping their psoriasis under control. Well, of course, when we're thinking about heart-healthy diets, the Mediterranean diet is probably one of the ones that we refer to the most. That is keeping to a minimum your red meat and looking for protein through things like beans and increasing the amount of olive oil that you have in your diet, anything that makes the cholesterol go down and is anti-inflammatory. Interestingly enough, there are some people who have found that a gluten-free diet reduces the inflammation in their body, and that can help both their psoriasis as well as their cardiovascular health. This isn't true for everybody, but within the psoriatic community, we do think about gluten and its impact on the skin and the disease. The risk of getting psoriasis is not increased by being a smoker. However, smokers who have psoriasis find it much more difficult to control their psoriasis. So we do encourage smokers with psoriasis to try to stop smoking to help both their disease as well as to reduce the cardiovascular risk associated with the inflammation and psoriasis.